where there are more doctors per capita, more hospitals, and more specialists, there's more death, less health, and less longevity. I'm not joking. I'm seriously telling you. Over the years, I have learned two things. A, to clearly say that integrative medicine is not anti-Western medicine. A lot of people think, oh, he is a quack. He doesn't know what he is talking about. No. Medicine or the medical sciences are meant to heal, H-E-A-L. And there's nothing to do with health. Health is completely out with the domain of doctors, hospitals, nurses, and things like that. Actually, a 14 countries, industrialized countries study showed where there are more doctors per capita, more hospitals, and more specialists, there's more death, less health, and less longevity. I'm not joking. I'm seriously telling you. This 14 country study is a very exhaustive study. And there is a study done by the WHO in Thailand years ago, I think about 40 years ago, where in Thailand, Bangkok they took. There are about 5 systems of medicine concurrently working. Pure Western medicine, as we call as medicine, then pure Chinese medicine, integrated Chinese Western medicine, then Samoa system where the father tells the son when he is dying as to how he should treat his patient, and it goes on generation wide. And the last is of quackery. And they did a study prospectively for 5 years, very well controlled study, which showed collectively at the end that all systems of medicine, mark my words, all systems of medicine were equally effective on society. This was 40 years ago. People are nonplussed. People said, oh, something wrong. No, now we know everything is right. Actually, that was very, very right. You would be surprised to know doctors went on strike in several countries over the last 25 years. Different times. Saskatchewan in Canada for 3 months, 25 years ago. Bogota in Colombia for 3 months, about 20 years ago. Los Angeles County 15 years ago. Israel recently, about 2 years ago. And Dublin, so about 5 years ago. Each one of these places, now audit shows in retrospect, when doctors went on strike and nurses ran the hospital, death rate almost fell down precipitously. I'm not joking. I'm seriously telling you. Whatever I say here, even a word is not outside the realm of what you think is science. I don't think that is science, but you think it is science. So I'm telling you scientific quote-unquote evidence. In reductionist science, that's our science today. Our evidence is very interesting. I had a slide. If I wish I had the slide. Now global warming, right? Scientifically global warming. Yes? 72, I was for 6 months or so, I was in London for some, I had to stand in for someone. My boss was going somewhere, so I had to go there. And that winter was 1 month longer. 72, I'm talking of 1972, as recent as that. And there was sleet for about 4 months on the ground. Nothing grew, not a blade of grass grew. And there was so much of hue and cry saying that we are in for an ice age very soon. It continued for 10 years. Suddenly, ice age gave place to warming. And we have evidence, so-called evidence. Ultimately, then the evidence is not correct. They say, well, I didn't look at the data. My secretary collected the data and the data was wrong or something like that. That's the explanation you give. But we don't say reductionist science doesn't have evidence. We say evidence-based science. What is the evidence? That's why I've got a nice slide. All our evidence is surrogate evidence. If you want to say world is warming, I can get you a slide to show how the ladies' underwear has been becoming smaller and smaller and smaller and smaller in the last 200 years. You've seen that? 18th century England, if you see, the underwear used to come up to this. And it's come now almost invisible. That stage it has come to. Naturally, the world is warming, very, very hot. So this is the kind of evidence we have. Supposing, let us say, God forbid, one of us has cancer. We go to the doctor. What do? They do a biopsy of that cancer, right? And then take the cells, put in the glass slide, smear them correctly, squeeze them out, and then poison with hematoxin and eosin, and then completely kill the cell, and look under the electron microscope, this microscope, that microscope. What is looking at? Tombstone of the dead cells. Albert Szent-Györgyi, a brilliant Nobel laureate biologist, wrote a book way back in 1960s called Introduction to Submolecular Biology. I don't know how many of you read that book. It's a fascinating book, almost an epoch-making book, where he says, I quote, I don't know what cancer is. I'm not saying that. Albertson Georgi was saying that in 1960, I don't know what cancer is, because cancer cells are like working like normal cells, absolutely normal cells. And I can't say what the cancer does by looking at the tombstone of the cell. They may look abnormal cells because they are squeezed out and distorted and stained and all kinds of things happen. But they are normal cells, they work like normal cells, and I don't know how to kill them without killing the other normal cells. Right? Agree. Now, if you know, I give you an analogy to students. Supposing a bird comes in here, let us say. Bhushan was telling me sparrows are very few in Pune. Supposing a sparrow comes in here. You want to know why did the sparrow come here? Where did it come from? Where it intends to go in future? And what is it here for? What are we doing in rejection? Catch hold of the sparrow, cut it, take a few cells, under the microscope, look at it, and then predict all about that sparrow, right? That's exactly what we are doing about cancer. Do you know what cancer is by looking at that biopsy bit? No. Do you know what will happen to the cancer by looking at the biopsy bit? But we have been predicting the unpredictable future of man. Every day we have been doing it.